So we're just going to go through a little bit about what cardiovascular disease is, which I'm guessing will be revision for many of you. So it's just kind of get it into your head, the background, so we can spend more time in the session talking about the dietary aspects. So we're talking about diseases of blood vessels, and the name relates to where those blood vessels are. So coronary heart disease, supplying the heart muscle, cerebrovascular disease, supplying the brain, peripheral artery disease, supplying the limbs, the arms, the legs. There are one or two other things that we kind of need to be aware of. Rheumatic disease, that's damage to the heart muscle and heart valves due to people having had rheumatic fever. Much less common than it used to be, thankfully. There's a whole host of congenital heart disease, and many people born with heart defects. So their heart structure in some way is not as it should be. Some of those will be discovered quite early on, quite visible, and the children will be having treatment, surgery to correct some of those. But I just wanted to draw your attention to CRY, the organisation that supports people with cardiac risk in the young. And that relates to those who perhaps didn't know that they had a congenital heart defect until they either had a heart attack, and sadly, at least one a month are dying. Young adults are dying because of undiagnosed heart disease. So if you're interested in having a little look about what that's about, there's a good website. There's a charity, but they're supporting people in that position. Then we have thrombotic illnesses. So deep vein thrombosis, a thrombus forms. That tends to dislodge and move, and if it hits the lungs, it will cause a pulmonary embolism. So that will be part of the lung that's not getting oxygen through to it because it's blocked. One of the blood vessels or you will be blocked, so you get bits of lung that may die because of that. And if it happens in the heart, you're probably going to get a heart attack, as part of the heart muscle doesn't have blood and oxygen coming to it. So those just a few, that's a starting point. So just a few more examples here. We often hear about angina, and angina is pain. It does cause other symptoms as well. It can cause nausea and pain, not just in the chest, but arm, neck, back, different places. We'll talk about heart failure a little bit in a moment. And the most common thing we hear about is heart attack. So angina does not mean a heart attack. A heart attack or myocardial infection is most often caused when we've got coronary heart disease. So diseases of those blood vessels feeding the heart muscle. And the myocardial infection is most often caused by a blood clot that's gone into the coronary artery and therefore blocking that artery, and we've got the muscle starved of blood and oxygen. So the heart may be damaged by that, doesn't necessarily stop working. A cardiac arrest is when the heart stops working completely. And that might be due to a heart attack, but it may be due to a range of other things as well. And then we've also got strokes, cerebrovascular accidents, so blood vessels to the brain, and that blood flow might have been disturbed or because of a blood clot, or so it's blocking the blood flow, or a bleed. You may get a hemorrhagic stroke or an ischemic stroke, both of which are going to damage the brain cells. And that's a kind of, you'll probably be aware of the FAST, the face, the arm, the speech, and it's that, we need to act very quickly if we think someone has had a stroke. So those are the kind of brief bit of background on what the cardiovascular diseases are. Just to remind you to think about what the structure of the heart is and which blood vessels we're talking about. We're talking about the superior vena cava or the aorta. We've got these massive blood vessels going in and out of the heart. And it's these, particularly the ones that are going into the heart muscle, that can be blocked, most often by atherosclerosis. So it's the atherosclerosis that causes bits that break off, that then have a blood clot forming around them and will block the arteries. So heart failure is something that we need to be aware of, and we will be dealing with from a dietetic perspective. So people often think that heart attack's a one-off event and that people recover or die. And what we need to remember is that often people will have multiple heart attacks, and each time that happens, they will have some damage to the heart muscle. So in effect, after each heart attack, the heart muscle becomes less effective. The heart function deteriorates. So we end up with something called heart failure. So the heart is not functioning as it should, and it begins to fail. And the New York Heart Association has got this classification, which kind of gives you an idea of the limitation. So we can, heart failure is on a spectrum of class 1, very little limitation on what people are doing. They've got back to being able to do things. They're not fatigued or breathless or not having palpitations. Then we've got class 2, when they have some limitation. So they might be okay just sitting watching TV or just relaxing, reading a book. But ordinary physical activity can make people tired, can give them palpitations or make them a bit breathless, or lead to angina. Angina has got a number of different classifications, and that this relates to the level of the heart failure. Class 3, marked limitations of physical activity. So people may be comfortable at rest, but even the most mild amount of physical activity will lead to symptoms. The breathlessness, it may lead to angina, palpitations, exhaustion. So class 4 is extremely severe. So people at rest, doing nothing, will have severe symptoms and pretty much constant pain. And we may well end up working with people with severe heart failure, because when you're very, very breathless, it's really difficult to eat. So you tend to think of people having heart attacks as most often being overweight, but people with severe heart failure will have lost weight, most likely, and they will often be actually quite underweight because it gets increasingly difficult to eat. The breathing, the breathlessness makes it very, very difficult. We will often get levels of edema around ankles and legs. There may be the requirement for nutritional support and sometimes fluid restrictions as well. So just be aware of heart failure as a kind of different side of the kind of classic heart problems that we tend to think of. So let's just have an idea of where we're looking at in regard to current trends in cardiovascular disease prevalence. So globally, it's a massive, massive problem. 7 out of 10 of the top leading causes of death are non-communicable diseases, and the majority of that is around cardiovascular disease. It does include cancer. So ischemic heart disease is at the top. Stroke is the second. And it does depend a little bit. The order of these risks depends on where you live. So it will be different for different countries. Low-income countries tend to be a little bit lower because they may have other causes like respiratory infections and neonatal deaths that won't be higher. But this is kind of overall picture. The WHO do a lot in trying to prevent and treat cardiovascular disease, and their Global Heart Initiative is about trying to strengthen that prevention and control of cardiovascular risk. So they work across the world trying to encourage better diet, decrease smoking, increase physical activity, those kinds of things. What's really interesting is this difference with the risk of different diseases in different countries. And I've left that link there for you. It just shows you where you live on how much your risk of cardiovascular disease is. So if you are come from Turkmenistan, it's not great. It's kind of pretty much at the top. But the UK is much, much lower down. So it might be interesting, depending if you're not originally from the UK or if you have family in different countries of the world, what the risk is depending on where you live. Very variable indeed. So in the UK, what do we know? 1 in 4 deaths are due to heart and circulatory diseases. So it's still a massive issue. We have about 7.6 million people living with cardiovascular disease in some level. We've still got this coronary heart disease or ischemic heart disease as the biggest killer worldwide. But in the UK, we're looking at heart attacks. Remember, that is, when not necessarily a cardiac arrest, but that's leading to over 100,000 hospital admissions each year. But we have about 1.4 million people who've survived. And of course, the survival is much related to how quickly people get medical attention, whether they happen to have someone who's able to do CPR, all those kinds of things. Where and when you have your heart attack makes a lot of difference. And we've got more than 900,000 people living with some level of heart failure. And if we're looking at causes of disability, the stroke is the main one. What's really interesting is that since the 1960s, the incidence of cardiovascular disease has gone down dramatically, and that's great. So it's gone from being about 1,000 per 100,000 of deaths down to about 300, different levels for men and women. So if you want to have a little look and a bit more information about that, you can follow some of the links. The British Heart Foundation website is a fantastic website. They do massive research into cardiovascular disease, particularly heart, but they also have masses of information accessible to the general public as well as to researchers. So just this kind of, again, you've got the link there so you can go and follow this up if you want to have a look. These are the most up-to-date data on the causes of death, and gives you an idea of in 2020 how many people died of different heart and circulatory diseases. So it is a massive, massive part of the disease, the deaths per year. And if you look at all deaths being 689,000, and look at the heart and cardiovascular aspect, it's massive. And compared to cancer, it's massive. So really worth looking at those. Just get an idea of where it fits, how important this particular condition is. So in the next screencast, we'll talk about some of the risk factors.